Hello, everyone. Welcome to week number 2, episode number 2 of Scrub Life Saturdays. This is going to be a forum where we talk about everything nursing. And my name is Zaina Sob. If you guys don't know, I've been a nurse for over 14 years. And this week we're going to talk about something that's been relevant. I'm kind of done talking about it, but I feel like since I'm doing a nursing segment that I'm going to go ahead and just touch on this 1 week and 1 week only. And it's going to talk about COVID and nursing. So if you've been on the same planet as me, that's all you've heard about is COVID, and everything related to it. And so I'm kind of burnt out by it because I'm a regular civilian and also a nurse too. So I've had like double doses of it. I can't escape it. But I feel like people might want to just kind of hear another view, like kind of like the insider story of what it's really like. So the first 2 points I'm going to touch on are going to be kind of related to the public, even though this is a nursing segment. I just kind of wanted to mention 2 things, and then we'll transition into like what nurses really need to know. So everyone asks, like, is it real? Like, for all the conspiracy theory people, they think it's fake, and it's definitely not fake. There are real human bodies that are being buried and that are dying in the hospital from COVID. However, it's not something new. So I'm a baby nurse. I've never dealt with an actual COVID patient ever. But if you're somebody like my sister, she's my younger sister is a nurse on an adult unit, and she's had COVID patients even before the pandemic. If you look at a lot of the cleaners that we use, it'll tell you like what viruses and things that it'll kill. It actually had coronavirus on there. So this is not something new. It's just something that was spreading at a rapid rate and overwhelmed the hospital systems. And that's why that pandemic really occurred, because we didn't have enough staff, equipment, resources all around. We didn't have enough of everything to take care of the amount of patients at the rate that they were coming in. So it's definitely not new. But that's kind of what caused the frenzy. That's what caused like the social distancing. We needed it to like dwindle down so we could keep up on the hospital end. So for anybody thinking that it wasn't real, you're wrong. Okay. So moving along, this is not going away. So a lot of people are waiting for a cure. They're not going to come outside even though the world's opening up until a cure comes. There is no cure. There's not even a standard of treatment. So right now, if you were diagnosed with COVID or if you have it right now, depending on the hospital system you go to and the doctor who's treating you, that's going to determine your treatment. There is no standard of practice. There's not like a routine set of drugs. They're really basing your treatment based on you, your symptoms that you're presenting with, how you're responding to whatever they're even doing and treating you with, and also just the doctor's preference. So there's no protocol right now. There is no cure. There will never be a cure. Just like there's not a cure for other things like the flu, like HIV, like syphilis. Those are all viruses that will never go away. There are just treatment options to help you, bounce back from it. So your options really are you either get a vaccine when they make one or you don't. Those are your options. Same thing with like the people who don't choose to get a flu vaccine. If you don't get one, what happens? You may or may not get the flu. So this is kind of going to be one of those same things. If you're somebody who's pro-vaccine, get it. If you do your research and you like it, get it. If you're somebody who doesn't trust any vaccine, don't get it. But those are kind of the options that you're left with at this point. So that's all I'm going to talk about as far as like the public standpoint. Now we're going to shift to nurses because we've been hit really hard, along with a lot of the other essential workers in the hospital field. Nurses have been hit really, really hard. They weren't prepared for what was coming. So I know a lot of people, people love to talk. They love to have opinions. And people, were saying things like, that's what we signed up for, but that's not what we signed up for. That's like telling a chef, go ahead and whip me up a meal, but I'm not giving you a pot and pan and you have no salt and pepper. You can't expect it to be the same meal when you didn't give them the tools to make the meal with. So in regards to nurses and why they were stressed out in the beginning, I was one of those nurses who was threatened of being fired if I even brought in my own PPE. So that was real life. That was happening to us. We were told that we weren't even allowed to protect ourselves and we would be reprimanded and our job would be taken away from us. But that quickly changed once the CDC started saying that the public had to wear masks. So then the hospital kind of had to comply and get on board. But there wasn't enough. We were doing things like wearing the same gown for the entire shift. And if you guys don't know, you're supposed to change a gown when you go from room to room to room. So imagine what that would make a nurse feel like, knowing that standard protocol that maybe they followed for their 14-year career like me is just thrown out the window because we simply don't have enough. If you were like my sister, they were wearing the kitchen aprons, like aprons that somebody would have at like a soup kitchen. That's what they were wearing, because the system was overwhelmed. Hospitals couldn't keep up with all the materials and resources that were needed to take care of these people. So, that caused an emotional stress on nurses. Nurses who were not even adult or ICU nurses were dealing with these kind of patients. They were being pulled from the clinics they were working in. They were being pulled from labor and delivery if it was slow. They were being pulled from, if you got CT scans and MRI scans, they were being pulled from all kinds of units to start taking care of some really serious cases, and they were overloaded. So that's kind of why the stress, like the nurses just reacted so emotional to it. Also keeping up with the death toll, keeping up with, just seeing sickness and, nurses' responsibility. I have friends and my sister, their responsibility was sometimes to hold the phone to a patient's ear or be on FaceTime while their family members told them goodbye. That's how a lot of people ended their last days in the hospital. So there's a lot that nurses went through. And it wasn't just a bunch of whining behind scenes. It was real life stuff happening. And this is not stuff that I've heard. These are cases that I've seen, people that I'm close to, coworkers who have actually had to deal with this. So nurses are very stressed, and that leads me to my next point. Like, even now the system is it's at a plateau. It's less overwhelming, but nurses have to recover from what they've seen. They have to recover from what they've been through, and they have to heal themselves so they can continue to give good care. So it was kind of hard during the pandemic. They couldn't get a massage if that was their outlet release. They couldn't go to their therapist if they were just seeing personal therapy. They didn't have a lot of access to resources. A pamper day, they didn't have that either because everything was closed down. So they were very isolated and felt very suffocated in their own feelings. But now, as things are opening and they can try to have those outlets. So nurses, if you're in a place or a state or a city where your nail salons are open, go get a pamper day. Go get a massage if they're open. If they're not open yet, you got to find other ways. Like, I know when I've been stressed, I've just gone to YouTube, Google ways to make me stay calm, ways I can get over being upset. There are tons of meditation videos. There are tons of self-healing videos. And before you knock it, just try it. Because sometimes just hearing something calming, even if it's for 10 minutes, can help just reset you or bring you back to a level where you're emotionally and mentally prepared for whatever day you're having, whether you're in the hospital or not. So you kind of got to be creative right now until the world goes back to its new normal. But you have to make sure that you take care of yourselves, whether it's working out now that the weather's a little nicer. I know it was kind of miserable here in Michigan because it was freezing. So it was kind of like you were really stuck in your house, but it's sunny now. It's 90 degrees today. Go for a walk or just be still. I know I love just being still in my house and doing nothing. That makes me very happy because I'm always on the go, go, go. So, just find whatever really resets you and makes you happy to take care of yourself as things kind of progress back to our new normal. And the last point I'm going to talk about is for nurses as well, is how to still love your job. I mean, a lot of us nurses seen the ugly side of our employer. We were dealing with things and being reprimanded for things and being threatened with things that you would not really feel great about. I mean, you never want to feel like you're just another number, you're just another body, you can be replaced. You never want to feel like that. But a lot of nurses, including myself, just felt like, wow, we're what you're relying on and we're very dispensable. Like the way you're acting is like we're actually worthless at this time and we're the one keeping you afloat. So you almost carry those feelings. It's almost like being in a bad relationship. And how do you still kick out your best knowing that your partner kind of like did something really wrong to you or destroyed you? That's kind of how I have always equated healthcare and being a nurse. So you have to make peace with it. You have to find your why about why you became a nurse. You didn't become a nurse for your employer. You didn't become a nurse, for your paycheck. You became a nurse because there was something in you that wanted to help or make a difference on some level. You have to find that. You have to find that because if you keep going back to an employer that you harbor feelings for, it's going to affect your performance and it's going to affect how you treat your patients overall, even if you don't mean to. So you kind of have to dig deep and don't let it consume you. A lot of nurses, I know we've been called heroes, and I get it. I get the standpoint of what people see us as, and I appreciate it. I receive it. I love it. However, you're not a hero acting alone. You solely yourself will not change the healthcare industry. You have to understand you have a job, and while you're at that job, you perform the best to your ability. You give the best care you can, but you got to clock out. And when you clock out, you're done being a nurse. You're done. You're done. You go back to your normal life. You go back to your roles of being a mother, of being a wife, whatever it is. You got to go back to that normal role, because you will harbor those feelings, and you don't want to feel like you're constantly giving in a situation and never really receiving, which a lot of nurses can feel like, about their employer, no matter how hard they try. So you have to not play hero all on your own. Just know that you're there to do a great job. Give the best care that you can, so that way when you clock out, you'll feel like content with yourself. You'll feel fulfilled with the job and the performance that you just gave all your patients and people you came into contact with. You've been the best team player. You've been the best nurse you can be, but you're done when you leave. You can't carry out on all the other roles, and it's not you're not Captain Save the Hospital. Okay, you're just a nurse. So play your role, because it's a very important role. So you have to make sure that you deliver that role at 100%. So that's going to be it for episode number 2. I'll probably stay on here for like a couple of seconds and just see if you guys have any questions. I know there was lots of comments. I can't read and talk at the same time, so I'm going to kind of scroll while I'm stalling here, say hello to people. Hey, Mario. Hey, Max. They all joined in. My brother's on here. My brother's actually, he became a nurse, and my sister became a nurse. They all followed my footsteps. He's actually a practitioner now down in Florida. Let's see who else is asking questions. My cousin's on here. Hey, Lynn. Who else? Trying to see if there's any comments I want to address. Yep, somebody's saying you definitely have to check into why you decided to do this. Yep, you got to dig deep. Hey, Jay. He appreciates us for our services. There's some people talking about politics here. I'm not getting into that. More hello people, and that's it. So I don't see any questions. Hopefully you got something out of that, and I just suggest moving forward. Life is going to resume. It's going to resume back to normal, but a new normal. So the world's going to open up, whether you agree with it or not. If you don't agree with it, just stay home. If you do agree with it, just take the precautions you see fit for you. Nobody has to tell you how to take care of you. So if wearing a mask everywhere makes you comfortable, go for it. If not wearing one makes you more comfortable and it's not mandatory, go for it. At this point, everybody has to be responsible and play a part in their own safety and in their own health and in their own mission to protect everybody around them. So you don't need to be guided every step of the way. You're adults, and do what you feel is best for you. So thanks for tuning in. I am signing out, and I will see you guys next week.